You're listening to an African Elements top news story for July 2025. Please visit our website at africanelements.org for more daily news. The Trump administration has significantly reduced funding for research focused on Black infant health under the guise of dismantling diversity, equity, and inclusion (DEI) initiatives. This has raised concerns among medical professionals and advocates for racial health equity. A federally funded study in Detroit aimed to understand why Black babies are disproportionately born prematurely, but was abruptly terminated by the National Institutes of Health, NIH. The NIH claimed the project relied on artificial and non-scientific categories linked to DEI, asserting it did not enhance health or advance science. Researchers dispute this, calling the decision politically motivated and part of a broader effort to dismantle DEI initiatives across federal agencies. Many projects focused on minority and LGBTQ health have faced defunding under similar rationales. DEI generally refers to frameworks designed to promote fair treatment and participation of historically underrepresented groups. In health research, DEI initiatives aim to address systemic disparities and ensure equitable benefits from research. The NIH's claim against the Detroit study suggests a rejection of race or social determinants as valid scientific variables, fundamentally misunderstanding how social factors influence biological outcomes. The study explored how stress from racism and poverty might alter gene function, leading to premature births, recognizing that health is intertwined with social and environmental conditions. When the NIH labels such categories as non-scientific, it implies that factors like race and socioeconomic status are irrelevant to health outcomes, ignoring decades of public health research on social determinants. Medical experts agree these factors are integral to understanding and improving health. Dr. Alex Peel, an OB/GYN, emphasizes that health-related social needs are essential to healthcare. Access to prenatal care cannot be separated from issues like transportation and food insecurity, which disproportionately affect Black individuals. Black and low-income individuals face significant inequities in maternity care, with existing structures creating unjust barriers. Research by Dr. Amani M. Allen highlights how racism drives systemic inequities in health sciences, showing correlations between racial discrimination and health outcomes. Racial health disparities, particularly concerning infant mortality and maternal health, are stark in the U.S. Infant mortality rates are disproportionately high among Black babies. In Minnesota, Black babies are twice as likely to die before their first birthday as white babies. Black Minnesotans account for 23% of pregnancy-associated deaths, despite being 13% of the population. Black and low-income people are 2 to 5 times more likely to die in childbirth than their white counterparts, underscoring the need for targeted research and interventions. Structural racism perpetuates racial inequality, leading to health disparities by limiting access to resources and quality care. Multiple forms of racism can shape physiological systems, leading to chronic disease and earlier mortality for Black Americans. Research on structural racism in healthcare aims to understand systemic failures affecting Black mothers and babies. The Trump administration's actions dismissing research on systemic issues exacerbate existing inequalities. In April, Trump signed an executive order making housing discrimination easier by requiring federal agencies to stop using disparate impact data to identify discriminatory policies. This makes it harder to prove systemic discrimination in housing. Days before the housing order, Trump signed a similar order discouraging the use of disparate impact data in student disciplinary actions, complicating efforts to address racial disparities. The administration also ended a wastewater settlement for a mostly Black Alabama town, labeling it as viewed through a distorting DEI lens. A federal judge ruled against the NIH's funding cuts to minority health research, declaring them illegal and an example of government racial discrimination. This ruling offers hope for affected researchers and communities, though it could be appealed by the Trump administration. The research team in Detroit has a 30-day window to appeal the NIH decision and is seeking private funding to continue their work. This ongoing struggle highlights the importance of advocacy for research aimed at improving health outcomes for historically marginalized groups. Copyright African Elements.